Welcome to Let's Talk Eyes from Atlantic Vision Partners. My name is Dr. Peter Sheridan from Harman Eye Center in Amherst, Virginia, Atlantic Vision Partners company. A little bit about myself. I'm an optometrist. I've been in practice for approximately 25 years. I'm a member of the Virginia Optometric Association, the National Glaucoma Society, and I've received the F. Dal Smith Leadership Award and Albert Schweitzer Fellowship. May is Hypertension Awareness Month, and today I'll be speaking about hypertension and hypertensive retinopathy. Hypertension is defined as high arterial blood pressure. The Joint National Committee of Hypertension Classification System classifies hypertension with a systolic blood pressure of 120 millimeters of mercury and a diastolic blood pressure of 80 millimeters of mercury. The systolic phase is when the heart chambers contract and act in a way that they push the blood out of the ventricles into the extremities of the body. The diastolic phase is when the heart chamber relaxes and the blood fills the heart cavity, and that is related to the diastolic number. And now there's different clinical classifications of hypertension. We have stage normal, which we spoke about. We have pre-hypertension or elevated hypertension, hypertension stage 1, and hypertension stage 2. Hypertension stage 2, it has a systolic blood pressure of 140 millimeters of mercury and a diastolic of 90 or above. There's also isolated systolic hypertension, which we have the diastolic that remains the same and the systolic is elevated. Therefore, it's usually related to patients who are older in this category. There's various types of hypertension. We have essential hypertension, otherwise known as primary hypertension, secondary hypertension, malignant hypertension, and resistant hypertension. With essential hypertension, 90% of patients fall within this category. They're usually diagnosed with 2 visits of elevated blood pressure at your doctor's office, and secondary hypertension is usually related to damage to the arteries of the kidneys. Other disease process may be contributing factors to secondary hypertension. We have diseases such as thyroid disease, kidney disease, renovascular disease, Cushing syndrome, and sleep apnea. Also, increased alcohol and salt intake can be contributing factors of secondary hypertension. Malignant hypertension, the next type of hypertension, is a more severe form of hypertension that causes degenerative changes within the blood vessels of the eye, blood vessels of the body, causing hemorrhages in the retina, the kidney, and alters brain function sometimes. Also, these patients might experience numbness in their hands, chest pain, blurred vision, and double vision. Resistant hypertension is related to patients who are currently on medication and have trouble controlling their blood pressure. These patients usually have a higher body mass index, and they also have diabetes or kidney disease. The CDC estimates that 1 in 3 Americans currently today are affected by hypertension, and 1 in 5 are actually unaware that they have the condition. And geographically speaking, the southeastern part of the United States actually has the highest prevalence of hypertension today. Certain lifestyle modifications that can occur for hypertension to lower the blood pressure are decreased sodium intake, decreased saturated fats, increased fruit intake. That's helpful. Also, aerobic activity, weight reduction, smoking cessation, and also decreased levels of stress, which is always helpful. Now, if hypertension is left unchecked for a period of time, it can eventually cause what is called hypertensive retinopathy, which is damage to the blood vessels of the back portion of the eye called the retina. It's related to systemic changes in the body, the end organ changes that cause damage in the retina called hypertensive retinopathy. So annual comprehensive eye exams are crucial to the identification of hypertensive retinopathy. So examinations by your ophthalmologist and your optometrist are very important. A dilated comprehensive exam and is performed also to detect hypertension. We use direct and indirect ophthalmoscopy. Now, it's vital that you have these examinations because hypertensive retinopathy actually is usually asymptomatic. you can have decreased vision, loss of vision, headaches, dizziness, and double vision, but however, it usually is asymptomatic. The longer the duration of the hypertension, the longer the damage on the back portion of the eye, called the retina. Now, as eye doctors, we monitor two main categories of hypertensive retinopathy. There's the chronic hypertensive retinopathy and also the acute. With chronic hypertension, we identify usually in the retina cotton wool spots, vein changes, arterial changes, and vein occlusions. And there are certain vein occlusions that are actually more common with hypertension, such as central retinal vein occlusion. If there's also unilateral damage to the eye, we have to rule out what's called carotid artery disease, because that usually is an indication that there's a blockage in the carotid artery if there's one side that has damage that is indicated of hypertensive retinopathy changes. So we would refer you for an evaluation for a carotid Doppler for your internist. Now, acute hypertension is more of the malignant hypertension, which when we have, excuse me, we have an elevation of the diastolic blood pressure of 110 millimeters of mercury or above. You have chest pains, double vision, blurred vision. It's in this stage where we usually have more severe condition and severe symptoms that occur, and we'll see evidence of swelling of the optic nerve in the back part of the eye. We see hard exudates and the formation of what's called a macular star. Usually these patients most likely are sent to the ER for further evaluation. Now, as eye doctors, we also have a grading scale. It's the KBW grading scale classification system that we use. Grade 1 has a better prognosis, where there's usually no symptoms at all. And 2 is actually where we see some changes in the arteries. 3, we have hemorrhages. And 4, grade 4 is usually a poorer prognosis, which is related to the malignant hypertension and swelling of the optic nerve. Is usually found to be bilateral. So the main treatment for hypertension is medication, and the control is ideal. And what we like to do is make sure that we follow you for about 6 to 12 months. Now, I appreciate you listening to me today, and thank you for joining us at Atlantic Vision Partners Let's Talk Eyes. I hope you join us next month when we hear Dr. David E. speak about cataracts. Thank you.